everybody. Today, here at XSculpt, I am here with one of our XSculpt docs, Dr. Batista, and we are talking about low testosterone in women. Thanks for being with us today. Okay, so my first question is low testosterone in women a real thing?
Yes. Testosterone is just as important in women as it is in men. A lot of women that have low testosterone are actually underdiagnosed. Your testosterone starts to lower when you after the age of 25. So it's really important to find out and get treated if needed.
Awesome. So if a woman has low testosterone, what are those symptoms that they can have?
So if women have low testosterone, they normally will feel more fatigued. They will be able to focus less. They have weight gain. They can even have symptoms of depression or anxiety, and often will go on antidepressants and have no response. So those are the women that we normally like to see for testing.
Okay, so these women who get prescribed depression medication actually have possibly low testosterone?
Yes. So low testosterone can cause symptoms of anxiety, depression, problems sleeping, decreased libido, fatigue. These can all be also symptoms of depression. So it's good to have your labs checked for testosterone deficiency.
Okay. So what are the treatments currently available for women for low testosterone?
So for women, we can either use creams or pellets. The creams are not as good because you can have levels that are not stable, and also you can pass it on to your loved ones or people that are near you where you apply the cream. For the pellets, the levels are much more stable. You will have them monitored, and you can have that done every few months, which is a lot better than having to apply a cream every day.
Okay. What would be some of the risks of testosterone therapy in general?
So testosterone therapy is very safe because you are going to have your levels monitored by a physician. Most of the risks are very rare. Rarely women can get maybe fine hair on the skin, or maybe a little increased acne.
Okay. And those are all treatable, I'm assuming.
All treatable, and they go away if you take the therapy away. Yes.
Okay, great. Perfect. It was a nice, quick video. Thank you so much for your time. We'll be sending you more of these videos. I will be putting Dr. Batista's contact information in the description below. So if you have any questions, please reach out to her. Thanks.
Thank you.